Hi everyone, it's Dr. Melissa Corso here, and today we are going to be going over the Athlete's Guide to Injuries. So by the end of this presentation, you should have a better idea about growth spurts in youth athletes and what that means for you. Differences between injuries and muscle soreness that happens after exercising, training, games, and fitness training. We'll also talk about common injuries that happen in soccer players, as well as how long it takes to return to sport after these injuries. We'll then touch on how to reduce the risk of these injuries, and we've talked a little bit about this along the way when we've spoken about recovery and nutrition. But we'll also talk about what to do if you think you're injured and how that relates to returning to sports safely. Because at the end of the day, if you are injured, we want to make sure that you get back to play as soon as possible, but we also want to make sure that there aren't any other risks to you from a performance standpoint, but mostly from a safety standpoint. So the growth spurt happens earlier in girls than in boys. It tends to happen around 12 to 13 years old in girls, and you can grow up to about 6 centimeters per year. So it's actually a lot of growth there. In boys, it happens a little bit later, so maybe around 14 to 15 years old, and even more growth, averaging about 9 centimeters per year. So if you think about that, that's a lot of change for your body to go through. And it doesn't just last 1 year. It can last 2 to 3 years, in which case you're having huge changes in your body and how much you're growing, how much you're changing, as well as how your body can adapt to that. And in terms of adapting to these changes, it can take up to 1 year for your body to adapt. So when we talk about the growth spurt, we're not just dealing with a few months, a few weeks, we're talking years. And even after you're done growing, it still takes time for your body to finish up all the changes that are associated with the growth spurt. Now, the reason it's important to talk about the growth spurt is for a few reasons. So from a performance standpoint, the growth spurt can lead to changes in coordination. So, your body becomes bigger, longer, heavier, but your muscle doesn't necessarily increase in strength or in mass. And so that can lead to difficulties controlling the body, coordinating the body, as well as how your body communicates to your brain. And so this is associated with that classic kind of adolescent or teenage awkwardness. So you might see that you have a big growth spurt, and all of a sudden, it's hard to move, or you feel like you're moving differently, and you really need to kind of learn how your body moves and so on, again, because your body's going through so many changes. This poor control of impact across joints, muscle imbalances, as well as muscle tension and uncoordinated movements can not only lead to changes in performance, but it might also lead to increased risk of certain injuries. So there are certain injuries that are more common throughout the growth spurt, and these are growth-related injuries. Most people have heard of Osgood-Schlatter disease, which is kind of knee pain right on that bump underneath the knee. This tends to happen because the bones grow, but the muscles stay the same length, and so you get more tension or tightness through the muscle pulling on the bone. Less commonly, or I guess people hear about it less, is called Sever's disease. It's the same idea, but it happens in the heel. Okay, so right at the bottom, near kind of right where your shoe would meet your cleats, is a common place as well. It's just that people don't hear about it as often. And so those are both growth-related injuries. In addition, during the growth spurt, you have lower bone mineral density, so your bones aren't as strong. And that's an important consideration because you're loading, you're working so hard, so it's really important to make sure that other aspects are optimized, like nutrition and rest. So when we talk about common injuries in soccer players, this list here is based on professional players. But in youth soccer players, it tends to be strains, so injuries involving the muscles, sprains, injuries involving the joint, and contusions, so getting hit, kicked, whether it's the muscle or the bone. Those are the three most common injuries. They tend to happen more often during games than in practices, which makes sense. And sprains and strains, so muscles and joints, okay? They are, of course, the majority of injuries, as I mentioned, but they're also the most common re-injuries, meaning oftentimes when people return to sport without appropriate healing and time, as well as appropriate rehab, they are more common, and they also take longer to heal than the original injury. So when we look at specific injuries in soccer players, we're looking at contusions. So that would be like a Charlie horse. Someone elbows you in the arm, someone kicks you or knees you in the thigh. Most of us have experienced that. And the most common are in the thigh, the foot. So let's say you kick someone else's foot, the knee, ankle, and calf. Low back pain is also very common. Ankle injuries, whether it's just irritation from playing too much or ankle sprains. We have quad, calf, and hamstring injuries. When we say a functional injury, we mean that there is no tear, there's no swelling, bruising, pain, but you might have a lot of tightness that's preventing you from doing something, that's bothering you every time you play, after every time you play. And if you continue along this line without addressing it, you might get further down the line, which we see down the list as hamstring and quad structural injuries, which means you actually get a tear, and that is even a longer return to play. We also have groin pain, concussions, Achilles and knee tendinopathies, so that's kind of related to Osgood-Schlatter and Sever's disease, the two growth-related injuries. Those aren't necessarily tendinopathies, but the tendons are what attach into the bone, and so those can undergo stress as well. And then we have knee ligament injuries, and I included this particularly because of the girls and ACL injuries. And so we want to make sure that we have an understanding of how long does it take for these injuries to heal or for players to get back after playing. Now, as I mentioned, this list is based on professional athletes. So what's important to remember is when we're looking at these return to play numbers, these are actually kind of the best possible. These athletes have access to immediate medical care. They have access to physiotherapists, chiropractors, athletic therapists, medical doctors, orthopedic surgeons. They have access to the absolute best. And so when we look at these numbers, we need to remember that as a youth and developing athlete, these might be even longer for you because you don't have that immediate access to care. So if we look at contusions, so that's getting hit, that's the Charlie horse, we're looking at 6 to 7 days, and that's probably similar in your case because you're just looking at improving range of motion, reducing pain, and making sure that it doesn't get any worse. Low back pain is 6 to 10 days, but this tends to recur. So the immediate low back pain might be resolved in 6 to 10 days, but not necessarily the problem being solved. So the low back pain can often come back. Ankle injuries range from 7 to 16 days, and this depends on the severity. So, of course, 7 to 14 days would be grade 1 or grade 2, so we're not looking at anything too severe. But it's important still to go through rehab to make sure that you reduce the risk of re-injury. So as I mentioned, the functional injuries of the quad, so that's the front of the thigh, the hamstring, the back of the thigh, and the calf, that's the back of your leg, is about 5 to 6 days returning to play. But if you go down and you look at hamstring and quad structural injuries, we see that that's ranging above 2 to 3 weeks. So if you notice that you have tightness in these muscles that you notice when you're playing and after you're playing regularly, it's important for these to be addressed sooner rather than later because you'll return to play sooner if you address it sooner than if you let it turn into a structural or a bigger problem. Groin pain is 10 to 17 days, and groin pain is a difficult thing to manage, and it tends to come back. So again, dealing with this sooner rather than later is important. Concussion ranges from 6 to 11 days. The reason I have this kind of starred here is that this is in adults, and as we'll talk about concussions on the next slide, you'll see that in Teenagers and adolescents, this is a different number, okay? When we deal with tendinopathies, so either in the Achilles, the back of the heel, or the knee, this is 14 to 22 days. Again, I would say this is optimistic because these athletes have access to immediate medical care and lots of different options, as well as they're doing a lot of training. So tendinopathy is typically managed with exercise, and these players are already at a high level of exercise. Now I'm going to skip down to the knee ligament injuries because we talked about the hamstring and the quad structural injuries already. So knee ligament injuries, MCL and LCL, these are the inside and the outside of the knee. These are shorter. These are, 3 to 4 weeks. That's already pretty long. And again, it depends on how bad it is. But that's short compared to the ACL, and that's 200 to 200 in just over 200 days. Again, this is fast. So current recommendations for youth athletes returning from ACL say they should be waiting at least 1 year after surgery and making sure that their rehab is complete. The time isn't so much as important as how strong you are, how well you move, and doing all the tests to make sure that you're able to return to play. The meniscus, so this is kind of like the padding in your knee. Sometimes it can become irritated or torn, and this can take up to 2 months to rehab and return to play. Now, the reason I think it's important to highlight the return to play time for these injuries is really to show you how much of an impact these injuries have and how much time it takes away from your training and your play. So as a professional, of course, you're getting paid lots of money to play, and you like I said, you have access to the best care. But as a youth and developing athlete, you're looking at trying to improve your skills, you're trying to improve your understanding of the game, how strong you are, how fast you are. So these injuries can take a significant amount of time away from your training and kind of set you back when we're looking at developing all the skills that you want to have to try and get to whatever level you want to play, whether that's university, whether it's for fun, whether it's professional. So it's really important to consider what amount of work can you put in to reduce the risk of these injuries. And if you can do that before these injuries happen, you're actually setting yourself ahead and allowing yourself the better opportunity to develop skills. And not only that, because the main way to reduce the risk of these injuries is strength training, fitness training, and kind of coordination training, you're also improving your performance at the same time. So it's a win-win situation. Now, I want to talk specifically about concussions because this is really important. Concussions are kind of like that invisible injury, and so oftentimes that can make it really difficult for players when they have a concussion. It's not like you're walking around with crutches and saying, hey, look, my ankle, I sprained my ankle, I hurt my knee, or you hurt your back and you can't move. So concussions are really just based on how people tell you they feel. And that can be difficult. So it's really important to understand concussions. Now, concussions can happen 2 ways. It can happen when you directly get hit in the head. So a very common way people will get concussions is when they're going up for headers and someone elbows them in the head. Okay? But concussions can also happen when you get kind of like a whiplash motion where a force is transmitted to the body, and then because the body's moving, the head kind of gets whipped around and the brain kind of shakes around in the head. So it's important to remember that someone can have a concussion whether they get hit in the head or not. How it happens isn't really as important as what the person is telling you they feel. And we will go over the signs and symptoms of a concussion as well. So that's really what I'm trying to highlight here. You can get a concussion without getting directly hit to the head. Unfortunately for female soccer players, they tend to be more common and more severe. And so it's really important to make sure that you get checked out and you tell people when you think that you might have a concussion. If you think you have a concussion, or if a coach or parent thinks that you have a concussion, it's really important that you immediately get removed from play and you do not re-enter until you're assessed by a medical professional who can say whether or not they suspect a concussion. The reason this is so important is the brain is really sensitive once it has a concussion. So if you get another hit to the head or another kind of whiplash movement and the brain gets shaked around, it's possible that you make your concussion worse, or it's possible that you have very severe reactions in the brain, which can lead to potentially comas or death. And so we've seen that historically in rugby players. So now there's Rowan's Law, and that's a direct response to what's called second impact syndrome. And that's exactly what happened with this rugby player. She had a concussion, she didn't tell anyone, she went back in, she got another hit, and unfortunately she passed away. And that's my fear-inducing story for all the players out there, to make sure you're telling your parents and coaches if you think that you have a concussion. Now, as I mentioned, it's really important to see someone if you think you have a concussion, to get assessed as well as to manage your return to play. What I would like to add to that is it's important to see someone who's experienced in managing concussions. The reason is because this is such an important part of sport now, lots of research is being done and it's constantly changing. So what you should be doing after a concussion, the recommendations, is constantly changing. If you just go see a regular medical doctor who isn't used to seeing people with concussions, they might not give you the appropriate recommendations or advice. And I've seen this many times where players or people are poorly managed and they come see me 3 months later still having issues because they weren't given the appropriate advice at the beginning, and that breaks my heart. So it's really important that you see someone who is experienced in assessing and managing concussions. The other reason is you want to make sure you get other areas of your body assessed, including your neck, eyes, and ears. So a number of different things can happen when you sustain a concussion or you get a concussion, and not all of them are related to the brain. So if we talk about a force being transmitted to your body and then to your head, potentially there are issues that happened in the eyes, neck, and ears that contribute to the symptoms you have that are not necessarily related directly to the brain, and these can be helped and worked on with rehab exercises and can help you get back to play sooner. As I mentioned a couple slides ago, the return to play from concussions is longer in youth and adolescent athletes because your brains are still developing so much. So it can take up to 4 weeks as a normal return to play timeline. And it's very important that you follow appropriate return to learn. So if you're in school, you need to return to learn first and return to play protocols. And there's a reason why those are in place, to make sure that you can safely return to your sport and reduce the risk of any future concussions or worsening concussions. So what are some signs of a concussion? When it happens, you might have loss of consciousness, so that would mean you black out. Just because you black out or you have loss of consciousness, it does not mean that your concussion is worse, okay? But again, it's really important to get assessed regardless. You might feel disoriented, you might not know where you are, you might not be able to speak or create normal sentences, you might feel confused, you might have some memory loss, whether it's before the game or what happened, and you might feel dazed or confused. You might not kind of be able to focus on what's going on around you. Symptoms of a concussion include having headache or feeling dizzy, having difficulty concentrating, sensitivity to light, sounds, or smells. You might have ringing in the ears, you might feel fatigued, tired, emotional, and you might have some vomiting. Here's a different slide that shows you the different feelings that you might have with a concussion. So again, this is just going through the different areas in the body. So you might have difficulty concentrating, difficulty speaking, difficulties with memory, confusion. You might not be able to sleep well, or you might sleep a lot. You might have headaches and dizziness, as I mentioned. You might have feelings of anxiety, depression, changes in your emotion, mood changes. You might have neck pain or whiplash, um, blurry vision, difficulty focusing. You might have nausea, vomiting, incoordination, numbness and tingling. So there are a lot of different symptoms. It's really important that if you get a hit to the head or you have a whiplash, a fall, or you're not feeling well, you're not feeling like yourself, you talk to someone and make sure you get assessed. Now, when we talk about reducing the risk of injuries, as I mentioned, we kind of touch on these during all our different presentations. And the first is kind of going back to what we talked about in those parent and player conferences when we talked about the fitness program, and that's to get strong. The stronger you are, the more you're able to control your body, you're more able to control the forces across your joints, you're able to control what happens to you. So if you can control your body, you're better able to control things that happen to your body and move properly. So there are certain movement patterns that increase your risk of injury. If we train appropriately, we can increase and improve coordination, increase and improve strength to reduce these patterns that are going to put you at an increased risk of injury. When you're stronger, you're less likely to be injured, and if an injury does occur, it might reduce the severity of that injury, as well as improve rehabilitation and lead to faster rehabilitation. The FIFA 11 Plus is a warm-up program as well as a strength. It has strength and running components that has been shown to reduce the risk of injuries in soccer players when it's done 3 times per week. So at the end of this presentation, I'm going to go through the strength component that you can do at home. If you do that 3 times a week, that's great. And you can also ask your coaches and say, hey, can we do the FIFA 11 warm-up? Can we do the FIFA 11 running drills? Because if you do these as part of your practices, you'll hit those 3 times a week. You do the strength components at home, and you have a great little program to reduce the risk of your injury, and this has been shown in research across the board. The younger you start, the more effective it is, which is great. And the last thing is appropriate recovery. And we touched on this in our Athlete's Guide to Recovery and our Athlete's Guide to Nutrition. And I'm coming back to it again. That's how important it is. So making sure that you're taking the appropriate rest. That means kind of making sure your training schedule isn't too high. You have time to let your body get stronger and heal and become more resilient. Sleep. So that was the main focus of our Athlete's Guide to Recovery, is making sure you have enough sleep, 8 to 10 hours, making sure that you're reducing your screen time before, you're getting enough quality sleep to make sure that your body is able to heal and recover. That's when most of the recovery is happening. And the last thing is nutrition, making sure your body has the building blocks to make your muscles strong. So remember, protein is important to make your muscles strong, as well as having enough fuel so your body can do what you're asking it to do, and so that's the carbohydrates. And these 3 things will help you kind of recover from your training and become stronger so that, again, we can reduce the risk of injuries. It all feeds into each other. It's kind of like a big cycle. So do you think you're injured? What do you do? So I always recommend getting assessed by a certified healthcare professional that has experience assessing and treating athletic injuries. It goes back to the same thing with concussions. You want someone who has experience in that area so you get the best recommendations for what's happening to you. The assessment is very key, and that will allow you to figure out what the problem is. So what is the injury? Maybe you rolled your ankle and you sprained your ankle. It's very common in soccer players, but maybe you also have a nerve irritation, or the muscles were strained as well. So sometimes it's not as simple as you think it is. It might seem like a very small injury, but the assessment might bring out other things that need to be addressed as well. The assessment will tell you how severe or how bad the problem is. This is a big factor in determining how long will it take before you go back to play. If you have a grade 1 ankle sprain, it might take you a few days to recover. If you have a grade 2 ankle sprain, it might take you more time. It may take up to 1 to 2 weeks and require some rehab. If you have a grade 3 ankle sprain, now we're talking even more time and making sure that we get all of your strength back, your range of motion, and balance back. So the assessment will tell you how bad is it, and will then tell you what do you need to do in order to return to play. Because returning to play is not just about pain, it's about function. So do you have your range of motion? Do you have your strength, your balance? How comfortable, how confident do you feel? Are you nervous when you go back to play? That was always my problem. You feel nervous, you're scared about getting injured again. If you play with that feeling, you're actually at an increased risk of injury because you're changing how you move, you're changing what you're thinking about what you're doing, and it actually increases your risk of injury. So the assessment is really that pinpoint key area to tell you where do you go from there. And again, making sure you're doing this with someone who has experience with sports injuries. Now, safe return to play. This is just kind of a blanket statement here. We, of course, can't go over each of the return to play protocols for different injuries, even those related to soccer players. We don't have enough time, and it's really irrelevant until you have those injuries. But as I mentioned, the assessment is key here. This will tell us your prognosis. So how long do we think it'll take for you to get better? Do we think you'll have a full recovery, a partial recovery, and so on? The assessment then tells us what do we need to do to get you back. What does the rehab plan look like? What can we do to reduce your pain, improve your range of motion, get your strength back? Every person is different because what caused them to have the injury might be different. The injury itself might be different. But rehabilitation is vital to return to play faster, as well as to reduce the risk of future injury. Even the smallest injury, like an ankle sprain that you think that once the pain is gone, the swelling is gone, you can go back and play, requires rehab, as the risk of re-injury is very high. And as I mentioned in one of the first slides, is re-injuries actually tend to keep you out for longer because you haven't fully healed from the first injury. That re-injury tends to be worse and then requires longer rehab. So addressing the rehab on that first injury is really key. Medical clearance is one thing, and it doesn't have to be formal clearance, the letter and so on. It's really just to make sure you're not returning to play too soon, and again, increasing your risk of re-injury. Just making sure that everything is good, you feel confident, and physically everything has healed, and you've done your rehab appropriately to go back safely. So in summary, a growth spurt can last more than 1 year, can last 2 to 3 years, and be associated with increased incoordination and risk of injury. So really make sure you're kind of giving yourself a break. Don't put too much pressure on yourself if you are going through a growth spurt, and give yourself enough time to recover. Most common injuries in soccer players are sprains, so joint and ligament problems, strains, muscle problems, and contusions, kind of hits to the muscle or the bone. Concussions are also common, and it's important to have an appropriate assessment and management to improve return to play success, as well as reduce the risk of worsening concussion symptoms in the future. To reduce the risk of injury, it really comes down to two things: be as strong as possible and make sure you have appropriate recovery. If you are injured, an appropriate assessment is key to determine what your injury is, as well as the severity of your injury. And this also allows us to create a plan for your rehab and a safe return to play. If you have any more questions, or you want more information about this PowerPoint or anything I talked about, please feel free to reach out to me by email, Instagram, Twitter, or Facebook. And the last little bit here is going to be going through the FIFA 11 strength, plyometric, and balance exercises, which you can do at home. And just a reminder, doing these 3 times a week is ideal for reducing the risk of injury. And ask your coaches to implement the FIFA 11 warm-up and running drills as well, which is part 1 and part 3 of the FIFA 11 Plus. So what you can do here is just pause the video so that you can do this exercise with the appropriate number of sets and reps. So in the middle we have difficulty level 1 for the plank, and you want to do this 3 times for 20 to 30 seconds. Once this becomes easy, you can go to difficulty level 2, where you alternate lifting your legs up while maintaining the plank position. And if that becomes easy, difficulty level 3, where you're lifting and holding that leg up instead of just alternating. Exercise number 2 is the side bench or the side plank. In the middle, we have difficulty level 1. You want to repeat this 3 times for 20 to 30 seconds on each side. And once that becomes easy, you can move on to difficulty level 2, where you're holding that side plank and then lifting and lowering your hip down to the ground. And then difficulty level 3, where you're holding kind of in that star position. Exercise number 3, you guys should know this by now, and this is the Nordic hamstring exercise. So level 1, you just have lower number of repetitions, so 3 to 5, and once that becomes easy, you increase as you go along. Exercise number 4 is a single leg stance. So here we're looking at balance, and what's important to focus on here is your form, making sure your knee, hips, and torso are aligned and straight. You're starting just by holding, and then you can increase difficulty by throwing with a partner or at the wall, and then having someone challenge you and making sure you're maintaining that form. The next exercise are squats, so you guys should know how to do that very well by now. Difficulty level 1, just doing as many squats as you can for 30 seconds and doing this twice. Increasing difficulty with doing walking lunges and then doing one leg squats, and making sure that your body alignment is staying as it should in these pictures. Here we have vertical jumps. Okay, so first you're just doing kind of squat jumps. Again, you should know these. Difficulty level 2 is going side to side. So these are like your skaters, right? Your lateral jumps. And then you have box jumps where you are in a squat jump, but you're jumping forward and back and then side to side, kind of like around a box. So injuries versus soreness, this is really important because as an elite athlete, you will experience pain, and it's important to be able to distinguish whether or not it's a problem, it's something that you should get checked out, or if it's kind of a normal part of playing. The reason it's important is an elite player who is frequently injured will potentially struggle to achieve their maximal skill level because they're not getting as much training and competition or exposure to different opportunities. And then beyond that, if you're more sensitive to injury, it can also affect your ability to acquire high-level skills as well as reach the professional league level, because at that point you're looking for resilient players who can, deal with a lot of training and playing and avoid some of those injuries. So injuries typically, but not always, will have a moment that you can say, you hurt it. So I twisted my ankle, I fell on my knee, or I fell on my back, I twisted wrong, and I had pain in my back or my neck. But sometimes it could be something small that you notice when you're playing. My hamstring feels tight when I'm playing or after I'm playing. And I'm noticing that every time I play or over time, this tightness is getting worse. Okay, so that might be another way that you might identify an injury. This is compared to muscle soreness, where you're playing and you're feeling like you're working hard, but you don't really notice anything going on. There's no moment in particular you notice pain. And after you're playing, you might notice some fatigue, so some tiredness in the muscle, but no pain. That's very specific to one area compared to another. In terms of injuries, I kind of mentioned already, you would notice this during your play time or after your play time. Compared to soreness, you might feel kind of more tired, but you tend to notice the pain or tightness hours later or the next day. The muscle soreness will tend to improve over 24 to 48 hours, and you'll notice that with the muscle soreness, if you try and warm up, there will be less soreness. And this is compared to injuries, which might kind of stick around longer. You might notice less change over time, and warming up might have a little bit of an impact, but you still might notice the pain there. Injuries tend to be on one side more than the other, whereas muscle soreness tends to be more equal from side to side, or at least very close. And the muscle soreness tends to be in larger muscles, so let's say all of my quads, all of my thighs, all of my abs, versus injuries, which tend to be a smaller area of pain. So you can either point to it, or the size of your hand maybe, or around a joint. In injuries where you have kind of a moment where you hurt it, you may notice swelling, redness, or pressure in that area, as well as bruising. Not always, but that's potentially it. So think of rolling your ankle. You might notice swelling and bruising afterwards. Whereas with muscle soreness, really there's no change in what your body looks like, but you might feel tightness, you might feel some pain with stretching, but nothing looks any different.